Good afternoon and welcome to today's King's Fund online event on innovation in social care. I'm Sally Warren, the Director of Policy here at the King's Fund, and I'm delighted to welcome you with us today. Social care has long had a history of driving innovation around service delivery, in particular being at the forefront of developing personalised asset-based services which are based on the strengths and assets of individuals and their communities. Today we're going to explore that in a bit more detail to understand what we can learn from those innovative approaches, and in particular how we can learn about scaling and spreading that innovation to more and more people. I'm delighted that we're joined by an expert panel today who I would just ask to introduce themselves, and then I'll explain how today will be structured. So, panel, Kate, can you say who you are and where you're from, please?
Hi Sally. Yes, I'm Kate Sibthorpe. I'm a member of the National Co-Production Advisory Group, known as NCAG, and we're a group of people with lived experience of accessing health and social care. And my experience is through my daughter, who is a young woman who has learning disabilities and autism. And we work really closely in co-production with Think Local Act Personal, known as TLAP. And TLAP is a partnership organisation that's basically all about closing the gap between the rhetoric that's out there in the world of social care and the reality of people's lives. So we talk about people getting a life and not a service. You know, we've got the Care Act and so on, but it's not like that for everybody.
Great, thank you, and welcome, Kate. It's great to have such a strength of recognition of the importance of services being designed with the user and not just done to the user. Thanks, Kate. Ewan.
Hi, Sally. I'm Ewan King. I am the Chief Operating Officer at the Social Care Institute for Excellence, better known as SKY. For those of you who don't know the organisation, it is a national charity dedicated to identifying and disseminating what works in adults and children's social care. I'm, I think, involved in this discussion today because I'm part of the team that's leading a project called the Social Care Innovation Network, and I'm going to talk about that more shortly. So that's me.
Great, thank you, Ewan. And Mike.
Hi, I'm Mike White. I work for Keyring. So Keyring's been working for 30 years as a not-for-profit organisation, connecting people so they can share their skills and live as independently as possible.
Great, welcome Mike, thank you all very much. So in terms of how today's going to go, we have around about an hour for the session. I'm going to begin by asking our three experts to start with some opening comments about their reflection on innovation and how we can spread and scale that innovation. And then it's very much over to you, the audience, where I hope you're already thinking of questions you want to ask this great group of people, and I'm sure what they say will also prompt questions. We have around about 1,200 people registered for this event, but I would say every one of your voice matters, so please do ask a question if you think of one, don't hold back. To ask a question, you should be able to see a box underneath the video, and this is where you can submit your questions. I will then be able to see your questions on this tablet and be able to put them to the panel later on today. And for those of you who are very good at multitasking, who not only can watch the video, ask a question online, you may well also be able to tweet. We would encourage you to do so, please, by using the hashtag KFOnline. Great, so I think that's all of my domestic introductions done. So I think we'll move quickly on to the substance of today's discussion, and we'll hear from Kate, Ewan and then Mike about their reflections on innovation and what we can learn from scaling and spreading it from the adult social care sector. Kate, over to you.
So, well, I really wanted to say why innovation really matters to me and people like me who access social care services. And I think although we've got lots of really good stuff happening, traditional services don't always work for people. So when you look at people's experiences, people aren't necessarily getting the best life that they could get. And so I think we really need some innovation to give things a boost. So, you know, Henry Ford said, if you always do what you've always done, you always get what you've always got. So there's definitely a need for innovation, and I think as well it's about recognising there's a huge amount of potential in people and in our communities that's really untapped, so there's very rich resources out there. And also my concern is that it's a bit of a postcode lottery, so there are lots of examples of fantastic stuff happening, but they're not everywhere, so there's a part of it for me is that the way services are going, it's not equitable and not everybody gets the opportunity to get the best life. I think that my colleagues in the National Co-Production Advisory Group would agree with me in saying that you can't do innovation without co-producing. So it's really, really important to involve people with lived experience, because it's our lives you're talking about. We're the experts in it. And together with Think Local Act Personal, we've produced Making It Real, which is, at its heart, it's a way of thinking about what good personalised care and support looks like. It's based on a number of values, so things like we're all citizens and we all have equal rights, and the values that really good social care is going to be person-centred. And to sort of help that happen, we've created Making It Real, which is a set of statements written from the perspective of both people who access services and also people who work in services. So there are I statements, which are about how people experience things when they're working well, and we statements from people who work in services, which describe what they're doing if they're doing things well. And it's a really flexible tool that you can use to have conversations with people about. And I mean, there are actually, I picked out 6 or 7 statements that I think particularly talk to innovation. So I would encourage people to have a look and see if they could find it useful.
Great. Thank you. Thanks very much, Kate. I'm sure we'll come back to a few of those issues, particularly around how if you're wanting to do things based on the strengths of communities, how that doesn't mean that a postcode lottery is unfair, but it's reflecting that actually communities all have different strengths and different assets, so it might look different in places up and down the country.
Yeah, definitely.
So we'll come back to that. Ewan, so Kate set us off really strongly about the importance of rooting this in people's lived experience and in the lives that people want to lead and how services can be shaped around that. You've got more of a perspective about how that can be shaped nationally and how you can share learning, so I'd be interested to hear your opening reflections.
So for about the last year, we've been developing what is called the Social Care Innovation Network. It's funded by the Department of Health and Social Care. It's led by a partnership of Shared Lives Plus, Think Local Act Personal, who Kate represents, and also Sky. And the starting point for the network is not so much to find new innovations, although that's always important to do, is actually to look at why there are so many good innovations that aren't growing. So I think social care, and it's not dissimilar to other sectors, suffers from a problem of having almost pockets of really good practice, really good strengths-based, asset-based approaches to care and support. But the trouble is they're just not growing so that more people can benefit from them. And it's not through a lack of trying, and we do know that the financial situation is very, very difficult. So the Innovation Network is bringing together local authorities, innovative providers of care, also people with lived experience in carers, to explore what are the conditions that we can foster in order for innovative models of care to grow, to use the jargon, to scale. Not all charities, not all small providers want to grow, but they do want to be sustained, they do want to thrive. And so this network is looking at both how we can scale those who want to grow national or regional, but also those who just want to do well and survive and thrive locally. What are we learning so far? I mean, loads of things. First of all, the scaling of innovation is a whole systems approach. It is not just the responsibility of the Adult Social Care Department, it is the responsibility of the whole place working together, and that requires leaders to have a real strong vision for what they want to achieve, working with people who use services and carers, sustaining that vision, and that needs to be in the NHS, housing, the voluntary sector, the private sector. It takes time, it takes dedication and committed leadership, so it's a whole system approach. I think commissioning, where it's going well, I think commissioning is beginning to change. It's moving away from that slightly short-term focus on what they call time and task, where they're just simply paying for the basic services to be provided. We want them to move towards outcome-based commissioning over the longer term, so that we're measuring services on their ability to deliver to improve people's lives and well-being, not just to deliver some outputs or some activities. And we're seeing co-production absolutely at the heart of this, because co-production can help you not just reduce duplication and waste, but actually improves the service, because it's a service that's designed by people who use the service, so it's more likely to grow and be sustained in the future. So there's just a few thoughts from what we're seeing so far.
Great, thank you very much, Ewan. And before I turn to Mike for our final kind of opening reflections from panel members, just a reminder to those who are joining us from home or from work, please do send in any questions you have to us, because I'm sure the panel would like to be tested thoroughly this afternoon to hear great questions from you. So thank you in advance. Mike, over to you, please.
Yeah, so I guess over Keeling's 30 years of existence, we've seen how much people can achieve if we believe in them and they believe in themselves. And concentrating on what people can do rather than what they can't do, makes an enormous difference in terms of, their growing reduction in dependence and growing interdependence, which is what most of us have in our lives, really. So they contribute more, they need less. Now that improves well-being, and that's the core duty of the Care Act, is to increase individual well-being. So anything we do that stops that or restricts that, we shouldn't be doing. Anything that promotes it, we should be doing more of. And of course it costs less as well. It costs the public purse less, and obviously that's important because there are other things that we can spend that money on. So it's very important that we concentrate on that. I don't think anybody would choose to live in service land. So if we can arrange for people not to live in service land, which is probably the same for most of us, then that's great. Part of Keeling's approach to doing that in terms of scaling what we do is that for the whole 30 years, the model of Keeling Networks has not been available to anybody. The name is registered, but the model isn't. And there's been countries all over the world who have taken up the Keeling network model, and we've supported them and given them advice, and they brought Keelingness in their own way to their particular part of the world. The one area over the 30 years where that hasn't happened is England and Wales. So really we're still the only provider of Keeling in England and Wales. So we wanted that to change because we want to increase our impact as an organisation. As Ewan's already said, we actually don't want to become much bigger. We don't feel the need to do that. We don't need to make any big profits either. So what we're looking at is designing a franchise model where other providers can provide Keeling networks themselves. And that way more people have the option to have Keelingness in their lives without us becoming bigger. So impact is what we're looking to scale, not the organisation. Now that's scaling the particular model. What we also want to do is scale the whole thing about asset-based approaches, really, because we think that just should be the norm. Should be the norm in health and social care. And our experience is that it isn't. So we're working with TLAP, we're working with Sky, we're working with Social Care Futures, to try and build that up so that it becomes, a much more normal thing that can happen.
Great, thank you very much, Mike. And I particularly like the quote of, we don't want to live in service land. I think we can all absolutely agree with that. Thank you. So I think that's a really helpful start to hear from kind of user perspective about the importance of rooting innovation in people's lived experience, how we can then be thinking about the systematic barriers to and enablers to making that innovation happen at scale and spread, and what that really means from a provider perspective as well, where you've got a great model, but you're probably as big as you want to be. So how can you help that, the kind of what's the strength about that model be applied by others? So really positive. We've got a good number of questions coming in. Before I start the questions, I will just say some people have been asking about where they can get things like the Make It Real statement, etc. We will put some key links on our Twitter feed later today, but generally I'd say Think Local at Personal, their website will be able to direct you to most places, but we will make sure you have access to some of those links as well. So the first question, which is from Mandy McKinnon at Stockport Borough Council. Hi Mandy, thanks for your question. Her question is that supporting social care frontline practitioners to try small tests for change can empower staff to make changes that help them help their clients differently. How can we introduce that change in a meaningful way? Do you support this kind of quality improvement approach? And I wonder if we should start with Mike, because it'd be interesting to hear your engagement with how you empower your staff.
Yeah, I think that approach is always an interesting one, because when you're trying to explain an approach to somebody, it's a bit ethereal, really. So sometimes it's very practical things that people can relate to that ensure that we get that point. And also being realistic that often when people first have some contact with service land, it's because they've probably reached some sort of crisis, especially these days. So not being afraid that actually some practical help might be the starting point to get to the point where they can, think about some of the options they might want on their menu. But as soon as that happens, then that's where the co-production comes in, and you start looking at that and saying, well, actually, what do you want to contribute? What can you contribute? What do you want to be involved? And not get stuck in that bit about, oh, I've done something for them, I'll do something else for them. The asset-based approach, is particularly looking at what asset that person's got. You can also use assets in the community and so on, but the starting point is that person. And I'm very pleased that the Sky video on asset-based approaches is very clear. It's particularly aimed at social workers. You could tell from the sort of language used and so on and so forth. So a quick look at that, will give an idea. And there won't be any surprises in there. I guess for me, the bit that needs to happen is further up the line, really. There needs to be a whole empowerment bit. If we get a situation over the 30 years, every now and then we've got a member of staff saying, oh, I didn't think I could do that, we get worried. If it was the right thing to do, surely they should be able to do that. And I think some of the fears of sort of duty of care, the fears of the publicity and stuff like that can feel a bit restrictive, where actually we probably know what the right thing to do is, so we should be supported in doing that.
Thank you, Mike.
I mean, just to build on that, I think the woman from Stockport was talking about testing at a small scale and then adapting and scaling up what she was trying to do there. I think that's a really good way of thinking about this, because there's always a tendency, I think, to try to bite off more than you can chew, really, and to say we're going to roll out this new approach of working right across the whole local authority. We're going to do it this year. I don't think that's really realistic, and it's better, I think, to start at a small scale, involve frontline staff in developing a new way of working, see if it works, evaluate it, and if it's working, then roll it out into other areas. So, for example, the London Borough of Camden has been rolling out asset-based approaches across Camden. It started in one ward. It did a bit of testing, and it involved frontline staff to see if it was going to work. It did work, and now they're expanding it across the London Borough. So I think that's a really good way of looking at the problem.
I think certainly the King's Fund, from a number of pieces of work we've done, have seen that there's real strengths in freeing staff to feel more able to make decisions based on an individual's need rather than being constrained by policy. So whether that's a Buurtzorg type model, health and wellbeing teams, a kind of bigger scale of empowering staff in, for example, Wigan, we see a lot of strength in that. I think there's been a real importance that kind of senior management have to be seen to live and breathe it and back it up. So something might go wrong. So in Wigan, one example is somebody wanted to go ice skating. They agreed they should do it and hurt themselves, but actually it was the right decision for that individual, and the fact that management supported staff and didn't say you made the wrong call because somebody got hurt was important at reinforcing that sense of this is about the people we're supporting and the lives they're living, not about our systems and processes. So great, thank you. I have a question now from Brian Langridge from BCP Council. It must be said I can't quite work out what BCP will be. And this question is around how can we support people like Brian, who's a commissioner, to avoid the feeling that they're starting from scratch when it comes to co-production? What's the best approach to build on in terms of what's happening in other places and then localise it with co-production? I wonder, Kate, if you could start with how can TLAP and NCAG help others approach co-production?
Okay. Well, there's various approaches, but in a way, co-production isn't a process. It's a way, for me, it's a way of being, and it's about having conversations with people. So, I mean, there are really good examples of local authorities starting to do co-production in a sort of systemic way. So places like Hammersmith and Fulham, where they're sort of embedding it throughout their structures. In other places, I've been doing some work with Shropshire, and they're just very open to having conversations with people and learning through conversations about how services could be better. And the National Co-Production Advisory Group is really happy to support things like that. But I can't stress enough that it's about talking to people and going where people are, not hiding away in your offices. You know, I had a director ask me recently, what should he do? And I said, well, why don't you just invite some people for coffee, you know, who live in your area, go and have a chat with them. And that's quite an innovative thing to do, but just talk to people, because we'll have really good ideas about how things can be better.
Thanks. I wonder, Ewan, if you've got comments to reflect on this, because quite a lot of what Sky's there to do is help connect people to the ways of working and the ways of thinking and the ways of being, so people aren't having to think that they're by themselves doing this. So what would your advice to Brian be?
So I would agree with Kate that there are now quite a number of areas I think are beginning to progress on co-production and to take it really very seriously. So I know, for example, that Oxfordshire County Council, who Sky have been supporting with their co-production journey, have gone through a 2-year process of setting up the structures. They've trained what they're calling co-production champions, who are people who use services who can be supported and are supported to help others learn to do co-production. They've set up a really good board that looks at all of the key decisions that the council are making on adult social care, so they're really involved in decision making. And what they've done really effectively is to try and capture all of this learning. And last month they produced a toolkit that is very much designed to help other local authorities begin to put in the processes that are necessary. But I would emphasise as well, I mean, this is about a different culture, this is about different behaviours, and it takes time. So you know, training is important, building co-production into how you appraise staff is important, making sure it's absolutely part of your planning process is important. So it's really, it's whole systems. So that would be my reflections.
I think for me as well, when you talk about learning and training and development and stuff, people who access services also would benefit from a lot of input around learning and development. So I did a course called Partners in Policy Making a few years ago, which taught me about how the system works and about just possibilities. So you know that local authorities could do stuff even if they're choosing not to at the moment, and you can sort of help them then move along the path to people getting better lives. And I think that's often omitted. People don't want to invest in families and people learning because they see that as, you know, their specialism. So it is very much about sharing as well, I think.
Great. Thank you. Mike?
Yeah, I think the only thing I would add to that is to make sure that that co-production doesn't finish at the consultation stage, which I think is can happen. You will see a few people, no matter how well you do the process, and what you'll find is that they all have different wants, needs, aspirations, and so on. So what you should then be ensuring is in place is a set of services or a set of support or the facilities for everybody to have what they need and to be able to input to their own personal service, not just to a general service.
Great, and I think that's an important point, because co-production isn't consultation or engagement, and quite often people can think it is, and actually it is a very different way of thinking, planning and delivering services, which is really important. And Brian, thank you for confirming that BCP Council is Bournemouth, Christchurch and Poole Council, which I should know because I live vaguely towards that direction and used to spend many a childhood holiday in Poole Harbour. So I hope it's sunny and warm down there. Ewan, the next question we have is from Jo Barnes from North East Lincolnshire, and she asks if there's an opportunity to join the Innovation Network. How can they find out more about it?
Well, there are opportunities. We're very hopeful that there will be a phase 3. So we're in the middle of phase, this is a very political politician's answer, isn't it? But we are halfway through phase 2. And therefore it's difficult for new organisations to join. However, we are hopeful that the programme will expand considerably into phase 3, and we will be looking for organisations to join. And equally, we will be looking for provider organisations to join. And I should mention at this point, one of the really amazing products that's emerged, I think, not so much from the Innovation Network, but from the work of Think Local Act Personal, is what we're calling the Rainbow. and we're going to post this up on the links later, but it's basically a directory of innovative, person-centred, strengths-based approaches to providing care and support. And it looks like a rainbow, and it covers all the different stages in someone's journey, potentially through the care and support system. And actually, if you touch into this document, you'll find a wealth of information about the different kinds of models of care out there, and it helps commissioners in particular have the access to the right information they need to make decisions and invest in these kind of organisations. So that hopefully she's forgotten my question by now. But we will be have a look at the Sky website. There's a section on the Innovation Network. We will be hopefully looking for new organisations to join shortly.
Great.
Can I say
Kate.
as well? I think Local Act Personal has a work stream called Building Community Capacity. So there are regular events, often in London, sometimes in Birmingham or Manchester, and a lot of those rainbow organisations have presented at those events over the years. So anybody can sign up and come to those events and hear presentations about examples of really good practice and just network and talk to people and make connections. So I would recommend people look at the Building Community Capacity Network on the TLAP website.
Okay, brilliant. Mike, were you wanting to come in on that?
Only to say that Keeming, have a number of networks in North East Lincolnshire, so we're always happy to, if you can talk to the local team about the work they're doing there as just a taster, but we are only one in the rainbow.
Okay, brilliant. So it sounds like there's lots of different networks and sources of support that people can tap into to help them understand what's happening and how they can benefit from the learning from that. So great, thank you very much. I've got a question from Martha Hampson from the Innovation Unit, which I think builds on that. And she's saying there's a lot of good evidence around what good looks like and the conditions that might help innovation flourish. But what happens to the learning about when things get really hard? When things just don't work. So do you have any views on how can the sector create the safe space for people to be able to have that slightly harder conversation about this has been really hard for me and how can I learn from others about this point where it's really hard? So that kind of sense of how can we support each other over the bumps as well as in the good times.
I mean, so I know Martha actually, and she's a fantastic coach of organisations that are trying to grow and trying to scale. And I think that word is actually apt, coach and coaching. I think organisations that are trying to grow, they need someone who can talk to them in private about what they're going through in trying to grow an organisation, because you're absolutely right, she's absolutely right, they will face significant challenges and setbacks. I actually coach a couple of organisations that are trying to grow at the moment, particularly in children's social care, and I think it's just really helpful to be a sounding board, it's a bit of a cliche, but to be a kind of critical friend, and to make those kind of people available to those organisations. And I would say that I don't think there's enough investment right now in the sector to help provide the kind of consultancy support that's necessary, the coaching support that's necessary to these organisations. So absolutely, you do need a critical friend, I think, to help you through the process. And I think Mike, you were talking to me earlier about how you're getting some support to look at different models at the moment.
Yes, we're getting some consultancy support looking at scaling in particular, because there are lots of different ways you can scale an organisation. So we were lucky enough to get on the Scale Accelerator programme, which is run by Spring Impact and funded by the lottery. So we've got some very good input about that, because we haven't got expertise in scaling, we've got expertise in what we do, and that partnership is really good. I guess one of the things for me really is I do think that part of it is our responsibility, and part of our responsibility as organisations to change the culture in which we're working as well. You know, I do feel over the last sort of 8 years or so during the period of austerity, I feel like we've become institutionalised as an organisation and quite sort of passive and quite moany. And you know, it struck me that actually it's our job to go out and say that, and actually to be a bit braver in terms of sharing. And to say, actually, this didn't work, you know, this went wrong. Because if everything worked, then we probably really aren't trying hard enough, really. And I went to the Public Health, Mental Health Summit last week. And I think the most interesting session I sat into was about someone from Greater Manchester talking about introducing public health, mental health ideas into a mental health system which was quite medicalised, and about trying to get away from that medical model which is quite deficit approach as opposed to asset approach. And she was just dead honest. You know, it was hard work. It was persistence. You know, it was guile. It was openness. It was just saying, look, we think this works. We're not saying this just for the sake of it. This is why we think it works, and this is what it works. So I think we just have got to relax a bit. You know, what goes around comes around, and we've all got a little bit tight, really. And I would include myself in that. It's hard to do. So.
Yeah. Okay. So a sense of failing isn't a bad thing. It shows we're pushing the edges, but the key bit is learning from failing and kind of picking ourselves up quite quickly, or having our networks and colleagues and friends help us pick up after failure and restart.
In theory, we will not talk about pilots anymore. We will talk about prototypes.
Great.
Prototypes is what you learn with and what goes wrong.
It's an evolution. Great.
And I think you have to take people with you, so the people who are accessing your service. So when things go wrong, it seems to me that organisations will often sort of pull up the drawbridge and they won't engage, or they'll be so frightened of litigation that they won't talk about it with the person who's affected. So on a very personal level. So if you've co-produced what you're doing in the first place, and it's shared decision making, and you're taking a shared risk and there's a shared responsibility, people are far more likely to accept that things might go wrong, as in your skating example. So I would just say, do all the shared stuff in order to decide what you're going to do. And when things go wrong, talk to the people who are affected in a very open and honest way. I don't think that you could go wrong by doing that.
Great, thank you. So I'm going to move on to a question from Rebecca Sicero from Social Care Wales, which I think is a good kind of next step from here. So we've kind of talked about how you can do co-production, talked about how you can learn lessons from when things might be hard or don't quite go as you planned. Her question is, what are some of the most effective ways of keeping momentum once change has begun? So kind of how do you keep the ball rolling? How do you keep making improvements? Mike, can I maybe start with you, because you've done this. You've kind of run the services that are living and breathing this kind of service user approach.
As I said at the beginning, I don't think we've done enough of it. So perhaps that's the momentum we're trying to achieve. I think the momentum in the organisation that's doing it, in some ways, is relatively easy, because you are building a culture which is self-perpetuating. That you are then recruiting people who think that way. And even if you have to make a step change, I remember Keering decided that it was classed as a learning disability organisation. Well, we hated labels in the first place, and actually we weren't dealing with just people with learning disability. We were dealing with a set of individuals who had all sorts of things. So we changed it. We said, well, perhaps we'll work with people who have come from the mental health teams. Now, for some people that was a bit of a shock, because they spent some years in that. But new staff coming in thought, well, what's the issue in terms of that? So I think that can be, that can help. You can do that, and we have a value-based recruitment process that looks at that. So we're interested in what people bring in terms of values, not necessarily what they bring in terms of technical experience. That's not the most important thing. So I think you can build that. In terms of building momentum, in terms of things like these innovations, I think that is a bigger issue, and it was one of the topics when we met as a group at TLAP a while ago, a couple of weeks ago, was actually how do we scale that? Because individually we're all relatively small, we all think the same way, but any individual organisation, any individual local authority, we might seem quite small. And I think in the past, the only way you could scale up was to win a huge tender. Whereas actually if you look at places like Thurrock now and Essex to some degree on their learning disability services, they're now saying, well, actually we don't need one big contract. We have a lot of different people in a lot of different places, a lot of different localities in our area. Actually we could have bits from all the rainbow organisations in there. So in some ways I guess it is perhaps breaking it down a bit so that the momentum doesn't come from size, it comes from shared vision. Okay.
Great.
One reflection I would have is that too often in the past I think we've relied on one or two often very charismatic heroic leaders, I think, who we hope will bring the changes around and will drive it through and will get there in the end. But I mean, very often it isn't really about one or two leaders, and those leaders move on inevitably. So I think we don't focus enough on middle management and people who are coming up through the organisation, because that is where a lot of the talent will be in the future, that will sustain innovations, will sustain the focus on an asset-based way of working. So I think so one of the themes that's emerged from the Innovation Network is that issue of middle management. I can't think of a better way of describing it, but are those people who manage teams, who are heads of service, who are assistant directors, who are coming up through the system, who really need to grasp this and be up for it. And then secondly, I would say absolutely have people who receive services, use services at the heart of the discussions, constantly reminding us of what we're trying to do here, which is improve well-being.
I think you need to really share the success stories, share where things have had a real impact on people's lives. And it's also about the staff who work face to face with people, and how organisations can free them up to be innovative, and how you can value those people. It's not got to be about salary. I know that can be an issue, but you value people in different ways, and just seeing people as human beings and sharing those emotions around the impact when people do get a really good life, I think it's a big motivator.
And certainly telling stories is a really powerful way of demonstrating impact, demonstrating progress rather than data. It makes it feel much more real to everybody, be it kind of a frontline service deliverer or a national or local politician. It can really bring it to life.
Yeah, and I suppose I'd just add one thing to that is quite often we hear stories about what's happened, but people who want to replicate or do things themselves, quite often they're looking for, well, so how did you do it? So sometimes share the how as well as the what, I would say.
What's the journey? So I've got a couple of questions here, which I'm going to combine together, and I hope that Tim Cholklin and Simon Jessup are okay with me doing this, because they're both really about the relationship between providers who are trying to be innovative and asset-based and commissioners who may not quite have come to the party yet, shall we say. So to what extent is your experience that providers sort of have to follow the lead that local authorities set, or have you come across effective ways where providers, if you like, are leading local authorities to be more confident about trying different innovative models and kind of stepping away from the big kind of time and task type model? Mike, can I start with you? Because I suspect that you've had some of these conversations over your career.
Yes, definitely. And I think what has been interesting is how that process has gone. So I would say for the first 20 years of Keeving, then that's what it was. We would have conversations with commissioners, we would talk about the model we were proposing, they would buy into it or they wouldn't, and off we'd go. During sort of the cuts and so on, that hasn't really happened. It's been much more sort of unilateral. You have to remember that the local authority took the cuts first. They took the hit first, so they had reductions in staff, they lost a lot of experienced staff, they really did suffer very quickly at the beginning of that. So that process of sort of doing what they're doing and just sort of keeping things going, was inevitable really. And I guess we as providers sort of fell into that we were really just sort of keeping doing what we were doing, and it's taken a while to sort of come out of that. What makes me optimistic is over the last 18 months is we've started to have those conversations again. We've started to have those conversations about, right, we still have this issue, we are still spending tens of millions of pounds on supported living programmes, and we know that there are people in supported living places who really could do with moving on. But actually, we disincentivise the providers from moving them on because we don't fill the place very quickly, and so they've lost money. But actually, we've got people who could fill those places much more suitably, really. So, well, okay, let's sit down. Let's all sit down and we'll have a conversation about why can't we do that, really. So I think that's important. I think that's the change that's happened. I guess the other plug I would put in, really, is that during that process, the direction from the government was to look at outcomes and commission outcomes. I honestly say that really hasn't happened. So what we've had is more and more sort of restrictive and tighter commissioning, and that's sort of been under the sort of umbrella of procurement. Most of it is really not needed. So any commissioner out there should take the Skills for Care course on commissioners. Will actually tell them the other things they can do other than procurement. Because if you are trying to produce a co-produced service that improves somebody's well-being, then commissioning a large monolithic contract, is that really going to do that? And if it isn't, then you really shouldn't be doing it. And you probably don't need to do it if you were aware that there were alternatives, really. So again, be a bit braver, get that knowledge in terms of doing something different, have a conversation with your providers. You know, someone described it, somebody from TBLAP actually described us, we're a community of interest. You know, people who use our services, parents, commissioners, providers, the communities, actually we're a community of interest. We ought to be working together, and we seem to have lost that trick a bit, really.
Great, thank you. And in that answer, Mike, you've also managed to answer Liz Goodger's question, who's from Manchester Health and Care Commissioning, who was asking, do you have any examples where outcome-based commissioning has really worked in adult social care? I think you've kind of said it hasn't really felt real so far. It's felt too transactional.
It hasn't, and I don't think the personalisation, the personal budgets and so on, again, they haven't been real. We were quite excited at Keeving when personal budgets first came along a decade or more ago. We thought that was going to transform it. We haven't really seen that appear. Individual Service Fund is the latest sort of iteration of it. That might or might not work. But it's back to Kate's point, it's about a different culture and a different approach to make it work, not a different mechanism. There is something fundamentally wrong, and it is about money and how's money. There's something fundamentally wrong that the people who are Keeving members have the same source of money as I do. It comes from exactly the same place, it only diverts slightly towards the end. Mine goes into a salary, theirs goes into a service. Why is my choice so much greater than theirs when it's coming from the same pot? So you know, something about that control over what people have is still missing.
One thing that is, I think, giving me some optimism is there are some local authorities that are trying to hive off as much money as they can spare, and they're trying to grow these pots under a kind of banner of innovation funding. So they're trying to deliberately encourage local organisations to bid for money. They're trying to reduce the bureaucratic burdens on that process. So North Yorkshire is one area. You mentioned Wigan earlier. These are not massive sums of money, but they are considerable given the pressure these organisations are under. So I'd be really interested to know how they've managed to create a pot of money that can at least start helping different kinds of organisations to enter the market and provide services. But absolutely, I mean, what I'd just building on what Mike has said there, I think we have become quite polarised, I think, commissioners and providers, and it's really much better if they can get together and they can design commissioning priorities and specifications together. And that is happening in some places, and I do detect it's heading towards a better place at the moment.
I think if we think about the direction for integrated care systems and the kind of health and care and well-being at a place-based level, that concept of we're all equal partners, we're not seeing that commissioner-provider split, I think is really important. And as much as that's being driven strongly by the NHS, social care needs to be absolutely at the table of that. So your mention there of Wigan was perfect, Ewan, because I'm moving on to a question from Kate Moody from Wigan. It's almost like you'd seen my tablet. So Kate, thanks very much for your question. Kate says, I'm an analyst at a local authority where we're looking to scale up person-centric, outcome-driven analytical framework. What's your approach to evidencing the impact of working in an innovative, personalised way? Oh, silence. Ewan, come on, start.
Do have a look at a blog by my colleague Alex Fox, who works for Shared Lives Plus. He's just written a blog with Clinton Farquharson, who's another, I think, a well-known leader in this area. It's about how we measure asset-based places. It doesn't have all the answers, but it's trying to point to some possible ways forward about how we measure the impact of these kind of services. Human performance indicators, I think, is the phrase that's come up, which I think is really clever. So there's some good materials beginning to emerge there. I think around personalised care, the NHS England is beginning to look, I think, a little bit more creatively at how you measure well-being. reduce social isolation. Some of those measures that I think are much closer to how people are experiencing their lives. So I think again, it's not as well developed as an area as it should be, but we're on the right tracks, I think, is what I'd say.
I think there's also potential in making it real, because you could certainly look at the I statements which describe how people are experiencing their care and support, and make measurements, if you like, against that. So we have had organisations, for example, doing online surveys with people against some of the statements, and we're also starting to look at how they relate to things like the key lines of inquiry, for example, with the Care Quality Commission. So I think there's a lot of potential in that, because that is all about impact and how people feel about their lives.
Great, thank you very much.
Could I just add
yeah,
something to that? So I think it depends what you're trying to measure in terms of the benefit. If you're trying to measure individuals' well-being, which I'll remind you is the core duty under the Care Act, then that's an individual thing. Yeah, and I think we shouldn't get sort of too carried away. We need to use the right scales, i.e. that individual scales, and we need to make sure it's communicated well to them and they're involved in a meaningful way that says, yeah, I can see the differences it's made. This has improved my well-being. And I think, nobody particularly measures my well-being, again, because my money goes into a salary rather than a service. How much impact are we going to, or burden are we going to put on people? If they were talking about economics, which obviously does come in a lot these days, then I think there's a couple of things about that. One is it's extremely difficult to measure the causality of doing something like this in terms of an economic saving. Keeling's tried it a few times. Our latest one was the beginning of last year, which was done by Housing Lynn, and they did research on 4 of the local authority areas. The local authorities didn't have records of what was being spent on people before they came to Keeling, so obviously that's quite difficult in terms of measuring that. One thing I would say is that a personalised and an asset-based approach is not new. So you can look back a bit, really, and the world hasn't changed that much, and people haven't really changed that much. If you look at the Supporting People report, which came out at the time that it was unring-fenced and sort of disappeared, other than in Wales, it says it all, and it's very well evidenced, and it gives the economic case. I don't think we need to keep redoing it. It's fairly obvious.
Great, thank you. So we're moving into about the last 10 minutes of the session. So if you have any questions that you've been pondering in your mind, please do send them through, because this will be your last few minutes to have an opportunity to do so. And having slightly panicked that I pressed the wrong button on the tablet a moment ago, I'm now back, it's fine, it's all good. So the next question we have is from Dave James, who's the Head of Adult Social Care Policy at the Care Quality Commission. And he asks, would a single shared view of quality, rooted firmly in making it real, adopted by CQC, local authorities, CCGs and Healthwatch, help in scaling good innovation? And I suppose unsaid in that question is potentially different approaches across those organisations hampering the scaling of innovation. Who wants to take advantage of an open question by a regulator about a possible change of approach? You don't get these chances every day. Mike?
Yes.
Okay. Yes.
Yeah, I mean, it would. So we're still suffering from different organisations reporting to different inspectorates, responding to different sets of KPIs. Being funded in different ways, and that does make it hard to look at a whole place, look at a town, look at a city and say we want to scale up these approaches to care and support. At the moment it's harder to do that because money is in different pots, we're inspected in different ways, we're still very obsessed with our own organisational measures, so our own organisations and how we perform rather than how the whole area is performing. So anything that brings together how we understand well-being, I think, is helpful across NHS and local authorities, housing and others. Yes. So I've run out of room there on that one, but that's my general view.
The
it
response
would be
to Dave
helpful.
is yes, that would be helpful.
Just said yes.
Well, it's a simple sort of wish. It's an
Yeah.
enormously complex thing to do, though.
Yeah.
Yeah.
You know, if you are measuring, if your reason for doing it is because you're trying to measure safeguarding, then you're probably not going to be good at measuring the risks that we encourage Keyring members to take, because that's how we all grow and do new things and learn new things, really. So I guess the reason why they're different is because they have got different agendas that come from different places up top. So it's probably a big ask, really. In my view, I suppose it doesn't matter if we have got the co-production right at the other end. If that person knows that they are getting the choice they want, that's improving their well-being in the way they want it, for me, that should be the only measure, really.
Great, thank you.
Yeah, I think, I mean, because it's very versatile and quite comprehensive, I think Making It Real could be a really useful tool for measuring quality across the sector.
Yeah.
I accept it is really a complex area, so there may be things that might not quite fit, but then I would just say come and talk to TLAP and come and talk to NCAG, and let's see what we can make of it, really. But it is all about people, so whether you're living the experience or you're working in services, it comes back to that, and that's where we need to be focusing our attention, I think.
Brilliant, thank you. My next question is from Joe Barnes, again from North East Lincolnshire. And Kate, I'm going to come to you first on this question because I think this is an interesting one. So Joe says, I believe that my organisation co-produces without calling it that. How important is it to label the way we do things as co-production?
I don't think it's particularly important at all, because it's just a way of being, and if you are doing genuine co-production, you'll know you're doing it, and you'll have really good relationships with people. Things will be happening, people will getting lives, you'll be driving things forward. I don't think you have to label it at all. It's a way of being, it's an approach or a belief that that if you work with people, you're more likely to get things right first time. And I think it's a recognition that, you know, as staff change in organisations, you know, like loads of people will tell you how many social workers they've had in their lives. People are there for the long haul, so I've lived in my house for 30 years. I've supported my daughter from birth. I'm the expert in her life. So I think it's just recognising that people are coming from that perspective, and it's a way of being, really.
So it's a way of being where the title doesn't matter, and I guess you'd rather people were doing that way of being without calling it co-production than people were doing something that was a bit too tokenistic and pretending that was co-production. So this is really, it is a way of thinking, of doing, of being, and that's the important thing, not the language.
Yeah, it's doing with, and you'll know if you're doing it right because you'll have really good relationships with people, I think.
I'd absolutely agree with Kate. I'll go one stage further in the sense that I now know that asset-based is a bandwagon to get hold of, because I've had services described as asset-based, because that's a good thing to call them when they quite clearly aren't.
Yeah.
So that's always a good sign.
Yeah, so this is where you really have to get below the headlines, below the kind of blurb to really understand what's driving an organisation. Thank you. My next question is from Samira Ben Omar, who's from the North West London collaboration of CCGs and works on equalities in particular in that patch. And I think I'm going to come to you on this one first, because this feels like it's around about that kind of system and place-based working. What Samira asks is, with more and more people coming together beyond their organisational boundaries to connect with communities and implement change, is it time that we move away completely from trying to change the organisations that we work within to focusing our investment on connecting with our citizens and our communities? So kind of trying to shift the system from thinking about its constituent organisations to thinking about how does the system reach out and with its community?
So I mentioned earlier that we are still overly fixated with the performance of our organisation for the organisations we work for very good reason. We're performance managed on that basis. We have to report upwards in terms of how we're doing. But I think the move towards integrated care systems, and we're in the King's Fund, which has got a lot of knowledge and about this. I think the move towards integrated care systems is the right way to go if we're going to focus on place. And I think one of the key features of the way the NHS is moving is that we have to become systems leaders. We have to look beyond our organisation. We have to go out and work with our communities more closely. I'd say we're some way away from that, but there is at least a language, a movement, I would say, that's building up around the need for us to think beyond our organisations, to actually work collaboratively with communities. And I guess all I can say is that there are some areas that are further ahead, I think. West Yorkshire and Harrogate, I think, is a good example. There are good examples in Greater Manchester, Hertfordshire and West Essex. So there are places that are moving in that direction. But she's right, it's absolutely the way forward. I think answers our question.
Yeah, no, that's great. Thank you. Excellent. We're coming into the last few minutes of today's session. So I am going to co-opt one question from Will Poyser, who's a policy advisor at the Department for Culture, Media and Sport. So welcome, Will. So his question is, what can the government do to help innovation scale and grow? So this will probably be your last question. So I think I might come to each of you and what's your wish list from the government to help you here? Are we so we're so used to come on.
So in the world of children's social care, and it's not without its flaws, but the DFE, Department for Education, has invested now for about 7 years in innovative approaches to children's social care. It's invested in supporting those organisations, and genuinely some of them are now growing and more people are benefiting. We haven't seen that in adult social care. I do think it's probably time to say, let's grasp this nettle and invest in innovations, because I think it's really hard for local authorities to stop doing one thing and recommission services while trying to create a new innovative approach. There just isn't the money around. So I think if we could invest in an innovation programme, I think that'd be a really good, welcome idea.
Great. And that's a really good answer, because we've had a couple of questions I've not had a chance to come to yet from Ryan Wise, who's been asking about kind of how we can learn from the how things are done in children's services and can that be applied to adults. So thank you. Mike and Kate, you've had a little bit more time to now think about your how government can help.
They should rename the Department of Health and Social Care the Department of Social Care and Health. And they should make sure that all the media outlets stop calling Matt Hancock the Health Secretary when he's the Health and Social Care Secretary.
Very good. Should be straightforward, but unfortunately it won't be. But yeah, thanks, Mike. Kate?
I suppose I'm thinking just cut through all the red tape and put it in the bin. So ease up on the legislation around commissioning, the stuff that stops people being innovative, and start talking about people as citizens who are entitled to things and not people who are in need, and just be much more positive about equality issues, really.
Okay. So something about the language too often can be about the burden of care and the crisis of a care sector, but actually what's been really striking is throughout the last hour, there's been huge optimism, huge positive kind of commitment to doing things differently and wanting to spread more. So seeing that happen.
Yeah, I think just celebrate people's potential and the great things that everybody does, whether you access social care or not.
Brilliant. I think that's a great point to end on. So I'm going to suggest at this point, on the basis of let's end on celebrating people's lives, celebrating the contribution they can make to society, regardless of whether we do or don't need social care, is a really important point, and I'm glad we've ended it there. So just leaves me to say apologies, we were not able to answer everybody's questions. You guys watching from home and at work did us proud and sent in so many that we've not been able to tackle them all, but I hope we've been able to touch on a wide variety of issues that colleagues wanted to hear from our experts from. So thank you at home for asking those questions. Thank you to the panel, to Kate, to you and to Mike for really being really honest, reflecting really well and sharing really insightful thoughts. I've found it a fascinating hour. So thank you for your time. And it leaves me just to say thank you and goodbye.